Right now in America's Forum, it has been 4 years since the president signed the Affordable Care Act into law. Millions of Americans have personally discovered that they can't keep their coverage, can't afford their premiums, can't see their doctor, and can't work as many hours as they once had. We'll talk with the Boston Globe's Howie Carr on why Obamacare is failing where Romneycare succeeded.
And as Western sanctions begin to hit Russia, the Russian finance minister warns that country's borrowing costs are escalating out of control. We'll talk with Kim Iskian of the Global Contrarian about the minister's comments and the danger of Russia defaulting on loans from Western banks.
And 25 years after the Exxon Valdez disaster, thousands of gallons of oil still pollute the beaches of Alaska's Prince William Sound. We'll take an in-depth look at how those events unfolded on March 24th, 1989, I should say, and what's being done today to repair the devastated coastal ecosystem. America's Forum continues right now.
And now it's hour 3 of America's Forum. Welcome back. I'm J.D. Hayworth.
And I'm John Bachman. We said Boston Globe. We should have said Boston Herald.
That's
very
right.
Clear to
because
clarify that.
Howie heralds his comments, and we'll have more with Howie Carr a bit later on.
And if we got that wrong, the folks up in Massachusetts would be screaming and yelling, as they should be. All right, moving on now. It's been 4 years since President Obama signed the Affordable Care Act into law, as we just told you. This weekend, the president released a statement saying that, quote, the share of Americans with insurance is up and the growth of healthcare costs is down to its lowest rate in 50 years. The Department of Health and Human Services said in the past 4.5 months that more than 5 million Americans have signed up for health insurance on healthcare.gov. That's still well short of the 7 million goal that they had. But despite those positives, 70% of Americans still don't feel that they know that they can get the...
It's not working for the average American who is involved in it. There's a membrane between political coverage and each of our individual lives. And very rarely does politics penetrate that membrane and actually affect us individually. Vietnam era, where there was the draft, it affected each of us individually. In this case, the healthcare law affects everybody, and it hurts most people. It affects probably 3/4 of them. And the result is that no amount of spin or propaganda or distraction can get over that. And then when you add in on top of that the coming rate increases that are predicted to be a doubling or a tripling of Obamacare premiums this year, starting to take effect in the fall, in the summer, the effect is just going to be catastrophic on this administration.
Now, more evidence now that the Obamacare is pushing through that membrane we heard Dick Morris talk about. The law remains unpopular with the public. Currently, 53% disapprove of the 2010 health care law, while 41% approve of Obamacare. Upside down there for the president. Opinion of the measure is virtually unchanged since last September. However, when opponents of the health care law are asked about the law's future, more want elected officials to try and make it work than make it fail. The deadline to sign up for coverage is March 31st. Those who are not enrolled in some sort of health care plan by March 31st will face a fine or some way be able to get out of it through the tax code somehow, as we've heard Dick Morris tell us.
Now, it's very interesting, John. When I hear about the second question asked in that polling, remember, sometimes it's the way in which a question is asked, because this program remains exceedingly unpopular. So unpopular that we asked him patiently to hang in there with us. And he joins us now by Skype, does Howie Carr of the Boston Herald and the great talk radio host at WRKO. Howie, now we can see you as well as hear you, and we welcome you back to America's Forum. You bet. Well, a lot of talk that especially in the last presidential campaign, that Obamacare was modeled on Romneycare in Massachusetts. Any veracity to that, and what are the major differences, I guess we ought to ask?
Well, I think it was modeled on it in a general way, J.D., but the biggest difference right now is that the Romneycare website and the sign-up program worked. and they decided to quote unquote overhaul the system to make it work with the Obamacare and healthcare.gov. And the system, they hired the same company out of Canada, CGI, and the system has been a complete failure. They were just fired recently. We're on the hook for hundreds of millions of dollars. I'm going to show you this letter that has been sent out to 84,000 Massachusetts residents, and it says you haven't been able to register for the new Obamacare, so you can use this letter as proof of coverage when you go to get health care services, the same way you would use a health insurance card. Do you believe it? This is a letter that could, and it says you do not need to take any action or pay any money to get this temporary coverage.
Now,
and this is going to go on at least until June, maybe until November, and even longer than that, because that's how long it's going to take to get this system up and running. It is a complete disaster. They at one point had over 70,000 paper applications because nobody could get through if they tried to use the system. I'll give you an example of how screwed up the system was, JD and John. If you they asked you one of the questions you had to answer before you could go forward was, are you currently incarcerated in a Massachusetts state prison? If you said no, it cut you off right there.
So Howie, is that basically a get out of jail free card, so to speak, for the folks going to? Well,
interesting way to put that, John.
Yeah, interesting. I was so focused on the question, not seeing the natural segue there. But is that the get out of jail free card, so to speak, Howie, for folks who could face this tax or penalty in the state of Massachusetts?
Yeah, absolutely. I mean, you know, since Obamacare started, a lot of people have been getting their penalties at the statewide level, or have been. And yeah, I guess this is the end of the state penalties. But you know, the thing is, John, it looks to me like this letter. I mean, you know, most of these cards can be counterfeited. But I mean, look at how easy it is to counterfeit this thing. All you need to do is put it in a Xerox machine, and you can go down, and anybody in the world can get free health care now in Massachusetts.
Wow.
Even more reason for illegal aliens to come here. The state admits that they've sent out 84,000 of these letters telling people, just go down to the hospital or the emergency room, run up the tab, don't worry about it. It's not your fault, it's our fault. Here's what they say is, as you may already know, our new website has not been performing the way it was intended to. That's the understatement of the year. And this isn't the only state, as you guys know. I mean, look at Oregon, another blue state, total disaster. Maryland, disaster. North Carolina, a red state, disaster. This thing is not working at all. I mean, there was an amazing statistic at the Wall Street Journal over the weekend. I don't know if you guys saw it. You know, you remember when they were promoting this thing, they were talking about pre-existing conditions, and you know, people were with cancer and with anything couldn't get insurance policies, and the pre-existing piece of Obamacare went into effect immediately upon the signing of the legislation. Do you know how many people in the first 3 years signed up to get on with pre-existing conditions?
How many?
107,000 out of 300 million people. That was one of the reasons they turned the system topsy-turvy, was so that 107,000 people could get insurance that they apparently couldn't get in a country with 300 million people. It's crazy.
You may have heard in the intro, as we were building up to the crescendo to see you on Skype here and have you back on the program, Howie, we talked about the polling saying that Americans wanted to see this law fixed, even though they disagree with that. Is that what you're hearing from callers to your program, or do they want to see this thing completely done away with?
No, I think that's one of those questions, JD. I agree with you. It all depends on how you word the question, and that seems like a responsible thing to say. Yes, we want to fix the program, but the reality is nobody wants to go through this and end up with a worse health insurance plan that costs them more money. I mean, we were making jokes last week on my radio show. You know, Elizabeth Warren, who claims to be an Indian, is now writing a book, and you know, in case she decides to run for president, I guess. And we were laughing and saying that we were hoping that there would be a chapter entitled, "If you like your medicine man, you can keep your medicine man."
Oh, Howie Carr.
He went there.
Well, Howie, it's always great to have you on. We see why the folks in Boston listen to WRKO and read your column, the Boston Herald. We look forward to our next visit with you again real
Thank you.
soon.
JD, remember, you didn't build that wigwam.
Oh, pal.
Wow.
We'll just let that go, Howie. Good seeing you and hearing from you. We'll talk again to you very soon. Don't you go anywhere. There's lots more to come. You can get a hold of us here and keep watching us.